You have your wings. I said in the morning, Unani Medicine is the body, wings are regimental therapy. I have created this own quote. I have not copied from anyone. It is just my knowledge. So मैं wings लगाया तो काम ही जा सकता. Patients are demanding for high quality, affordable, holistic care. UK पॉन्ड्स में देती पैसे, यूरोज में देती, डॉलर्स में देती. You do with proper aims and objectives, no? You do with proper niya. You do with proper intentions. Definitely money will come to you. Allah has written money. जमीन को आने से पहले आपका रिजल्ट लिखा गया है. It will reach to you on your table. Don't worry. Just have faith. See, in Bangalore, 60 to 70% doctors are working in allopathic system of medicine hospital में काम करते हैं. अगर वो 60% यूनानी सिस्टम के वास्ते, हिजामा के वास्ते, लीच थेरेपी के वास्ते, वीर शिक्षण के वास्ते काम करेगा तो कितना बड़ा काम है. See, now what happened? People are trying to scrap our ministry also. Ministry of Minority, they are trying to remove. Government is trying to remove. There are so many protocols are there, and there are so many people are behind that, and we should face that. See, you cannot avoid the practicality of life. जरा बात तो समझो. पहले लेवल वाले PhD, PG, यूनानी इंटरव्यू. You cannot escape from the practicality of the life. People are here. People will go. People will come. People will go. No one is permanent. Understand the practicality of life. Focus on your vision of यूनानी system of medicine. अगर आप यूनानी करना चाह रहे हैं, PG करो. PG को खड़ा हो. PG के बाद PhD करो. I know there are so many difficulties, so many obstacles, so many hurdles, so many problems. Females के लिए ससुराल रहता है, husband रहती है. There are so many different kinds of departments you have. हमारे साथ आने मस्त आराम से है, थोड़ा काम मिलेगा. You try to convince your husband, you try to convince your mother-in-law, father-in-law, जो भी आपके जो important pillars हैं, उनको convince करो. हमें यहाँ पढ़ेगा तो हमारा सैलरी 1 लाख रुपया मिलती है, तो 1 लाख रुपया से हमें आराम से थोड़ा घर शिफ्ट कर सकते हैं. वी कैन डू सम मोबिलाइजेशन वर्क. सुबह मेरा फिटनेस रखा होता, यहाँ दिल्ली में सीट मिली है करोड़बाग में, वहाँ गए दिल्ली के लिए कुतुब मीनार देख के माशाल्लाह देखी ली थी, म्यूजिक सेल्फी सब लिए. देन यू गो टू आगरा ताजमहल. यू हैव सो मेनी थिंग्स टू डू. व्हाई आर यू फोकस ऑन योर टीवी घर वैसा? थिंक वेरी हॉलिस्टिकली. आई एम हियर टू टेल यू this only. The main aim of my talk is to tell you this only. 11:30 12:30 बजे खास मेरा नहीं हुआ वो, अब हो रहा है खाने के बाद. खाना खिला कर. Anyways, so people are taking salaries. How much? 70, 80, 90, 100,000 तक भी ले लो. Ma'am, I am right or wrong? I am right or wrong? Madam is the deputy superintendent of not police, National Institute of Unani Medicine. Madam को पूछो होना तो PG स्कॉलर्स ही यहाँ 2 दिन कहीं 3 वहाँ की 4 दिन नहीं. पूछो मोहम्मद दे आर ड्रॉइंग सर्विस. दे विल टेल यू. आई विल शो यू ऑल्सो इन यूट्यूब. आई विल शो यू. यू सी, यू गो टू UPSC. मैम आज तक ना कोई सैलरी के बारे में ना कोई प्रोफेसर बोले, ना कोई टीचर बोले, ना कोई उस्ताद ना बोले ना. सच में बोले. we have finished our studies in 2014-15. उसके बाद से हम ना कोई भी इतनी सैलरी नहीं. तुम्हारी यूनानी मेडिसिन अच्छा पढ़ो, तुम्हें सेंट्रल गवर्नमेंट की जॉब मिलो, स्टेट गवर्नमेंट की जॉब मिलो, ऐसा PG है, PhD है, स्कॉलर सब बनती है. सब कोई भी बोले नहीं. बोल पड़े तो हमें भी कहते हैं. Anyways, jokes apart, बोले नहीं ना शायद हमें ख्याल नहीं करे थे. We are highly thankful to our teachers who has given us ilm nafiya. Alhamdulillah for everything. So this is the concept. UPSC.in. This will change your life. Nobody will tell you. See, कुछ भी नहीं बोलते शायद. अब तक तुम्हें भी इंटरनेट में देखे नहीं. I don't know about PG and other things. अंडर ग्रेजुएशन जो अभी कॉलेज में ही या जो प्रैक्टिस कर रही, यू सी, यू फॉलो दिस 4-letter word. Your life will be changed. But you have to wait for that. 1 साल नहीं, 2 साल नहीं, 3 साल नहीं, 4 साल वेट करो, उसमें क्या है? वेट करो, you wait. This will change your life. यूनानी के और डिपार्टमेंट्स हैं, CCRM है, वहाँ जाओ, उसकी वेबसाइट देखो, वहाँ कोई जॉब्स देखो, बेंगलुरु में भी रहती, चेन्नई में भी रहती.
Competitive exams.
No, this is for jobs.
Jobs. On this website where?
Yes. You can also write competitive exams in this. You can write IAS exam, you can write IPS exam, you can write IFS exam, you can write IRS exam, और बहुत सारे हैं 24 कैटेगरी के हैं, वो भी लिख सकते हैं. और इसमें CDS का एग्जाम है, that is not for us, that is for MBBS candidates. CDS नहीं, I am sorry, वो MBBS का है, वो हमारा नहीं है. एंड KPSC का तो छोड़ो, माशाल्लाह, लखनऊ का पब्लिक सर्विस कमीशन, ये जब पे तक उठेगा डाले तुम एप्लीकेशन 5 साल 6 साल करना होगा. इंटरव्यू गया फिर 5 साल 6 साल के बाद में माशाल्लाह. Anyways, they are also doing now Lokayukta have come, Lokpal have come, they are doing fast track process. उसमें भी ज़्यादा छोड़ सकते हैं. That these two websites you can take, but focus on this. KPSC.com.in खाली KPSC डाले तो हो जाता है. YouTube में देख ले तो. See, these are all just hints. You have to take the way. So these are all modules. Patients are coming from UK. कहाँ निकलने के आ रहे हैं? क्लिनिक खोलो, छोटा मोटा क्लिनिक में पार्टनरशिप करो. You do your work also, but simultaneously you do this also. When you get your chance, you give your way. Simple as that. Relocation का है, वो सभी तुम्हें क्या है, so mutually but ये कर ले सकते हो. You tell your mom, dad, I have got so much of salary, I can help my family members in financially, economically. Help कर सकते हो तुम्हें. घर में बैठा क्या करती? यो मैं ये नहीं आ रहा, मैं बोल नहीं आ रहा. क्या करना? These are not reasons to give. Okay, so ऐसा है. And I have few 1 or 2 videos I'll show now. मैं 2 videos वो दिखा दूँ, मैं पेशेंट की टेस्टिमोनियल. And alhamdulillah I have been honored by Superintendent of Police Yelahanka Division for my services in COVID. Unani Medicine. And you know Ravish Kumar sir? How many of you know Ravish Kumar sir? NDTV. Ravish Kumar sir. Alhamdulillah, sir had invited to me in his home. I have photograph with me, I'll show you. मेरे DP में है सर की. He is the one of the influential personality, a loyal journalist, a loyal media man. सर घर को बुला के आसाम में आप जो काम कर रहे हैं. We were in Assam for 15 days for helping flood victims. We got support from National Institute of Unani Medicine, Bangalore. They have given medicine us for Unani Medicine. और थोड़ा एलोपैथी मेडिसिन दिया, हम वहाँ काम करें. Then sir called us to do अफ़ज़ा पिलाए, माशाल्लाह यूनानी जूस पिलाएगा, सर के हाथ से अवार्ड ले लेगा. He has a tight security. Ravish Kumar sir has tight security. He is a NDTV में prime time नहीं 9 बजे रहते हैं. So he had called us. Alhamdulillah, it's an opportunity for me. My parents' blessings, my teachers' blessings. आप सब भाई बहन की दुआएं हैं, दोस्तों की दुआएं हैं. These are all the prospectus of Unani Medicine. Rumana is my classmate, Najma is my classmate, Sumaya is my classmate, Masood is my junior, Hussain is my student. They are all doing Unani Medicine practice. So you please change the way from today. Change the narratives of your brain. सोचने का जो तरीका है ना, उसे बदलना होगा. डेक्लोडेक्सा कब तक दे लेंगे? मैं भी स्टार्टिंग में गया हूँ. But जरूरत पड़ी इस नंबर के याद नहीं. I did not use that in a unjustified manner. I used it wisely. तो यूज करो जब जब जरूरत पड़ती है. Emergency medicine is emergency medicine. We cannot touch that. We cannot beat that. We cannot beat that standards. Unani medicine तो सोने पे सुहागा. That nobody can beat. अभी मैडम भी बात करती, you see the grip of her speaking, and मैडम की जो टेस्ट, ये जो स्लाइड्स थी, जो टेस्ट पेपर से मैडम के that also she'll show. You see, ma'am, inspired from her. get inspiration from her. Talk to them also. Take some time. She will guide you how to do PhD, PG, कैसा करना उसमें भी. आमिना मैम को बुलाया था मैं. She has done her PhD, but she not come because of other work. You try to change the way you think. What Tumkur में रहो, what Bengaluru में रहो, one city is not the way you have to be. तुम्हारा standard is अलग. Because you are the Unani teams. Your standard is totally different. Anyways, I'll show you one or two slides and I'll go back. So, Wi-Fi. When I was in 2015 or 16 or 17, I did 2 cases of beach therapy. Beach सुबह को बोले हमें ले लाख छोड़ डाला होता है. Just know the aims and objectives. बोलो ना वो. ले लाख patient को छोड़ा, patient को नहीं बोला. beach ले ले रहा हूँ. इसका protocol है. छोड़ डालो. आराम से wait करो. 3,000 4,000 अगर गरीब है तो फ्री करो करवा. सर आइए सर. I have a small YouTube channel. I do some videos also in the interest of public. Okay, so मेरा channel है. If you like, you can subscribe, share it to other people so that I can. Few videos of patient who are speaking about the testimonials in UK. You can see the testimonials. The Unani Medicine inauguration Hyderabad का उसमें लाए. This is one case of this is one case of venous section I am doing. Okay. In this video, I have my senior, super senior. Her name is Dr. Amina from Kola. She brought the patient. You see, I have kept 100 pad below because the time should not be bad. उसके लिए कितनी ड्राई है. I have used 18 number needle. ब्लड फ्लो अच्छा आने लगेगा. और पेशेंट को मैं कैसा खड़ा हूँ बोले तो एक पैर ऐसा एक पैर ऐसा जो पैर चाहिए वो पैर खींच लेंगे. The extension I have given the extension like this, and if I am doing on the left leg I am using this position. If I am doing on the right leg I will take this position. So I am doing on the right leg. You can see that पैर is सामने, this पैर is पीछे. Okay, and you see there is so much of blood. इसमें ये नहीं आता, आवाज़ नहीं आती, स्पीकर आते हैं आवाज़।
लिंक शेयर कर सबकी लिंक शेयर कर
No, I just wanted to show one or two video members.
लिंक शेयर
This doctor, she is a Unani doctor. She was in Baltic country, you know, Lithuania में थे हम। She was in Lithuania में। वहाँ पे जाके हॉस्पिटल एडमिनिस्ट्रेशन करके वापस फिर अपने घर आ गए, घर वापसी हो गई। She is also doctor. She is working in Kolar. सोनिया भाषा बोलता काम कर रहा है। इन्हों की तारीफ ही करेंगे नानी की, ऐसा हो रहा है।
ऑक्स केबल
You can use it.
साउंड
Anyways, you can watch the videos when you get time. If you want to really change, if you really want to do something for yourself, your family members, your society, your country, you go and see. There are numbers. बहुत कम लिखी videos ज़्यादा नहीं. Not only mine, there will be different Unani doctors. They are very hardly very few. You can see that also. Sound तो आता ना मुझे एक डायबिटिक फूड का मैं आपको वीडियो दिखाता हूँ, जस्ट 1 मिनट है। उसमें पैर का पूरा डिकेट हो गया था, द डॉक्टर से टू एक्टिवेट द वन फिंगर से, तो उसके वास्ते डिश थेरेपी आई हैव डन। दैट यू कैन सी दिस वीडियो आई हैव रिकॉर्डेड इन दावोजी समाज नेशनल शो ऑफ यूनानी मेडिसिन। During Corona, ma'am, Power TV has taken our interview. Digvijay News TV, they have taken our interview. Corona में interview लिया था। यूनानी मेडिसिन जो शानदार, उसे भी कैसा करे, क्या है, वो उसे भी है उसमें। ज़्यादा तो फायदा नहीं सुनी नहीं आता, बाद में होना भी जानते हैं। One video I'll just show you regarding this also BTV have taken Arshia जी का interview उसे भी लिए थे। और हमदर्द के टाइम पे दैनिक जागरण वाले भी लेके हैं इंटरव्यू। और दोस्त को जो है गिवन इंटरव्यू कैंसिल अच्छा। Even our health minister Dr. K. Sudhakar sir is also using Arshia ji, so that video is also there. He has clearly said in that video. India now also taken during Corona COVID times. ये वीडियो चेयर ज़्यादा This is the ये पैर थोड़ा ये हो गया था, ये उंगली है ना, तो वो उंगली पूरी खराब हो गई थी। लीज थेरेपी के बाद में वो रिपेयरिंग हुई। आफ्टर लीज थेरेपी बिफोर ऑल्सो आई वांट टू ये वो पूरा दिस वाज टोटली एम्पुटेटेड मैम, दिस इज हील्ड, सी दिस इज हील्ड ऑलमोस्ट, दिस पेशेंट इज ऑन बिल्कुल, वी डिड हिम फॉर फ्री ऑफ कॉस्ट। लास्ट टाइम यूना वेदा में आए थे कॉलेज आए, आई होप यू रिमेंबर, सी दिस ऑन द दिस एंटायर wound is healed.
How many sessions?
2 to 3 sessions में you will get
How many
the
days of
results.
gap?
Ma'am, see, it depends upon, again, see, I showed the video, no, before that, this is was same only, same form here. See, see this, only 1 inch, ma'am, that's all. एक लीफ ले लेगा ना, कि हमको जख्मा को छोड़वाना है। You do HIV, HbSAg, VDRL, VDCT, HB percentage is very important. So all these things are important. अगर खून कम रहा है, लीच करता ले तो खून जाले को करता है। 8 hours, 10 hours, sometimes 15 hours लीच थेरेपी में खून जाते रहता है। It oozes. Okay, don't go like water. It oozes small in a droplet form oozes रहता है. You have to be very specific. How long will see? This therapy session will give in a different topic. 1-1.5 घंटा you have to wait. Observation करना. हल्दी डाले तो पूरा लीच they will vomit out and you have to treat. So ठीक है friends, I will take leave. Patients are नीचे. Those who want to come for hijama session, they can come. Those who want to come for venous section session, they can also come. Now Asha will take the lead. I am very thankful to all of you for keen observation on my talks, and I request 2 PG scholars and Asha ma'am to tell about the salaries.
Of course.
Please tell. You listen, you encourage, you inspire.
Sir भी है ना.
Sir भी हैं यहाँ पे. Sir, why I am telling this because my topic was scope of Unani medicine in worldwide, benefits, salaries, and other perks. That is why I am telling you. Otherwise, I would have taken this topic also. I request doctors, 2 doctors from Unani medicine. They can tell how much their salary they are getting. I will give the
Scholarship, not salary. Government is paying you.
internship, so that others can inspire and join your institution.
गवर्नमेंट पे कर रही हो ना पढ़ने के लिए.
गवर्नमेंट पे कर रही है पढ़ने के लिए. You can hear from 2 PG scholars. Any other PG scholars? Oh, Sumaya, please tell. You tell, no? Whatever you want to tell. थोड़ा मेरा. Stand now. Sumaya, please stand and place your attention words.
Assalamualaikum everyone. Actually, everyone who has done BUMS, I encourage them to take attempts 1 time, 2 times till you get the PGC.
No age limit.
Yeah, there is no upper age limit. Everyone who has done BUMS, they should go for it. Whether you are married or not married, you have kids. I have 2 kids. Then also, you can do it.
She is my classmate, in fact.
You should do. Inshallah.
Tell about your internship.
Stay fund. We are getting stay fund for that. Right now I'm receiving 63,000 per month.
Thank you.
No tax, not tax payable.
The amount is non-taxable. अगर आप टैक्स पे कर रही तो वो भी अच्छा है. फ्यूचर में कमाता तुम ना. टैक्स पे करो. I request everyone to pay tax. And she is one scholar and second scholar रहेगा. अब एलोपैथी हॉस्पिटल में जाती 15-20 हज़ार कुछ 6-8 घंटे काम टाइम वेस्ट करती. That time you utilize on your PG studies, no? Please talk to me.
Assalamualaikum everyone. Myself Shima from National Institute of Unani Medicine. I got admission in NIUM in 2020 and I am from that background where there is not much trend of getting education. Almost after 12th or just a UG, BA or BSc, they get us married. So I am the first one from my family that has come this far, but do not take that this is not the limit. Do not ever doubt yourself. Whether it's a big or small opportunity, go grab it. And PG is equally important as UG. Also, me and one of my batchmates, we have the page on Instagram for AI PGT motivation. You can follow it from there. So we started getting 55 in July, 55,000. Then it got increased in second year 60. Now we are getting 61,000 approx per month. 63, sorry. Since today only we are in final year. 1st of January we have come in final year, so we'll be getting probably 66,000 per month.
So you heard about her, ma'am. आप भी एक बार बोला था गवर्नमेंट यूनानी मेडिकल कॉलेज पीजी anybody can tell. Yes, please come. Come here, so that everybody can. See, she is also one of the inspiring women. She said about her degree and her education, and also she encouraged you people to join her Facebook, Instagram page for PG.
My name is Simon and I am studying in GUMC, Bangalore. Actually, I am one of the first batches that came in for PG there, and I am from All India quota. I am from New Delhi, but I opted GUMC just for the sake of Jilvat Azinian because I was getting Advaya in Niyam. So we have less stipend than Niyam, but we are receiving 37,500 per month. So it's easy.
Thank you very much for all your efforts, and I also thanks everybody who has trusted our organization to join this session. It is very important. Please continue this. If you cannot come, you please share on WhatsApp, status, Facebook में काम ही डालो. आपको नहीं तो दूसरों को तो फायदा होता है. Thank you. Assalamu alaikum. Please hand over. I am handovering mic to Arshia ma'am. She will take care of the lead. And ma'am, those who want to come for hijama session, they can come. थोड़ा सुन ले ma'am, that very important है. Ma'am has a topic.
Am I audible? Yes, ma'am. Do you need mic? Yes. You need or not? Yes. No? I will not give any introduction because we are having very less time. Let us go directly to topic. Role of Ilaj with Tadbir in Amraz and Isfan. I am lucky today because 90% of the audience are females. Okay. So, main content, we'll see what is Ilaj with Tadbir. Brief introduction of various Unani regimens. Various regimens useful in the management of Amraz and Isfan. So my talk is purely on gynecology. Okay? I am not going to deviate from my topic. So what do you know about Ilaj with Tadbir? How many are from final years? Second year? Do you know what is Ilaj with Tadbir? So I don't have to discuss that. So what are the various regimens used in Ilaj with Tadbir? It is listed here. So here what I have listed is usually used in Amraz and Isfan. There are many more Ilaj with Tadbir procedures which can be used in other diseases. Okay? So here I am not going to highlight all the Ilaj with Tadbir techniques. Only 2 or 3 I will highlight which are most useful in our daily practice. So here we see hijama first, so I will not go in detail. So these are pictograph, representation of all the procedures. What we are using in our daily routine practice. So let us come to hijama. Urdu में, English में, किस में? English is okay for you?
Yes.
So let us come. From morning I think so you are listening that you are going for hijama camp. So my main topic today is hijama in amraz and dysphonia and gynecological diseases. So do you know how many types of hijamas are there? Yes. So here we see that hijama is a very simple technique which can be easily used by a clinician also in his or her training. So there are two types, dry cupping and wet cupping. Bill means when we use cuts, we call it as hijama bill, sure that is wet cupping. Then if we are not using any cuts, it is called as hijama bila sure dry cupping. Again dry cupping are of two types, that is hijama nari and hijama ghayr nari. So if you use fire to create the vacuum, then it is called as hijama nari. Then, what are the diseases where hijama has been described in our classical books? So, usually when we are teaching our MD scholars, we don't for empirical treatment. First, we will see what has been said in the literature. Whatever has been said in the literature, first we will try to see that what they have given, and then we implement the same thing in our practice. So, here, whatever I am saying you, it is not my own experience, but these are the experience done by our physicians, scholars, thousands of years back. The same technique, the same method, till date it is same. There is no change. There is no change. It is used same from thousands of years. So what are the diseases where we can use hijama are vulval eruptions, uterine prolapse, displacement of uterus. I think so already you people know these terms. I don't have to explain. Final years? No, no? Dysmenorrhea, menorrhagia, leukorrhea, inflammation of the uterus, amenorrhea and hysteria. So these are the diseases where hijama is used commonly at that time when it was practiced. Okay? So what we are seeing that hijama is not only used for musculoskeletal diseases or neurological diseases, but it was also used in gynecological diseases. Okay? So now, one by one, I will say where the hijama is applied in the different diseases. In vulvar eruption, the scholars have said that we can go for dry cupping. You will see that mostly they have done dry cupping. In very few cases, wet cupping has been done in gynecological diseases. So you can see here, they have said dry cupping, okay, on the lower back if the patient is having vulval eruptions. Okay. So this was a site which has been given in the books. Then uterine prolapse. So in uterine prolapse also we can do dry cupping. And again the site which is listed in Unani books are different. Some authors have said below the breast, some have said suprapubic, some has listed back. So any three places you don't have to apply all the three places. Any one place you can apply the dry cupping. So in uterine prolapse also they are saying to apply dry cupping. So what are the areas? Below the breast, suprapubic and back. Okay? And most important thing, Razi has said that if you are applying the cups during uterine prolapse, in the cases of uterine prolapse, you should keep for a longer time. One thing. Second thing, best to use aromatherapy along with cupping. Okay, suppose the patient is having uterine prolapse, along with cupping you should do inhalation of खुशबूदार दवाओं को सुखाया जाए. Right? Right. And सुखाने के लिए कहा उन्होंने उन्होंने ये नहीं कहा कि why? Because what they were having the concept is different. What we think the concept is different. क्यों कहा उन्होंने कि आप जब यूट्राइन कोलैप्स है तो मरीजा को कप्स लगाइए, देर तक लगाइए और साथ ही साथ हो सके तो खुशबूदार दवाएं सुनाएं। सडेशन, व्हाट इज द नीड? कपिंग से पेन नहीं होता ना। हमारी यूनानी एथिकल बोलते हैं महम क्या होता है, खुशबू को अट्रैक्ट होता है। जब भी हम खुशबूदार फ्रेगरेंस सुनाते हैं तो देयर विल बी upward displacement of the uterus, because in uterine prolapse what's happening, the uterus is collapsing from its place to downward displacement is occurring in the prolapse of uterus. So when we are giving aromatherapy, so they say that uterus is attracted towards the aromatherapy, खुशबूदार दवाओं की तरफ attracted रहता है। जब हम खुशबूदार दवाएं सुनाते हैं तो prolapse कम होने के chances रहते हैं। तो ये concept यूनानी में है। What is it modern concept of this? Hormones, well-being, because usually aromatherapy will give you release of well-being hormone, that is dopamine. Second thing is when we are saying the patient to inhale, जब आप inhale करते हैं तो usually the abdominal muscles are activated. What is pelvic floor muscle exercises? They say in uterine prolapse, pelvic floor muscle exercises give 30% response in cases of uterine prolapse. 30. That means when we are giving aromatherapy, according to Unani concept, it is causing upward displacement of the uterus. But according to modern concept, when we are saying to take patient deep inhalation, actually the abdominal muscles and the pelvic muscles are getting activated. With that method, we are actually saying them to do the exercises. That is nothing but pelvic floor muscle exercises. So whatever tickle exercises are advised in uterine prolapse, giving aromatherapy actually activates this tickle muscle exercise. Okay, so this is the modern concept. So whenever the patient is having uterine prolapse, along with Unani Medicine, we can say the patient to activate the abdominal muscles, because abdominal muscles also play an important role in decreasing the symptoms in prolapse. Okay, so you see our philosophers around 1000 years, 2000 years back they said to do aromatherapy. Now we are using pelvic floor muscle exercises to revert back the uterine prolapse. Next is displacement of uterus. Again in displacement of uterus, they are saying dry cupping. It can be anterior displacement or posterior displacement. Uterine prolapse is downward displacement. Uterine prolapse is downward displacement. The uterus can be acutely anteverted, that is, it can be displaced anteriorly or it can be displaced posteriorly. Suppose the displacement is posteriorly, cupping should be applied anteriorly on the lower abdomen. Clear? If suppose the patient is having anteverted uterus, acute anteverted, then you have to apply cupping on the lower abdomen. Very good, audience are good. They are not sleeping. Okay? So it can be applied around the umbilicus. Then dysmenorrhea. Again in dysmenorrhea, different authors have different opinion. Some say that we should go for fire cupping. Some say we can go for dry cupping. Okay, here again we can see that they have said you can apply the cups around the umbilicus or suprapubic, that is lower abdomen, or around the umbilicus. Both are correct. Okay. You can apply dry cupping like fire cupping or normal dry cupping also. Then menorrhagia. In menorrhagia also we can apply cups below the breast. Again here you have to remember we have to apply large cups. Okay, 1 cup below each breast you can apply. This is said by Razi, but Ibn Sina said that you can apply the cups along the milk line. Do you know how the milk line runs? You know? That means you people know what is milk line. So Razi said, Ibn Sina said that apply the cups along the milk line in cases of menorrhagia. Then only in one book, Masihi said that if suppose the bleeding is not getting stopped after giving all medication, then what you can do? You can go for wet cupping in between the buttocks. Okay, that is sacral region. Sacrococcygeal region. In that place, you can go for wet cupping. If it is not getting reduced with any medication, so you can go for wet cupping in sacrococcygeal region. See, this I have showed you. This is the milk line. So Ibn Sina has described this method. What I have observed in my practice, that Ibn Sina's method works better than other methods. Patient responded well when we applied cups like this. One is below the breast, in one suprapubic, one umbilical radius, para-umbilical radius. So this is demonstration with live demonstration what we have done in the patient. So this image we have taken permission from the patient to take this. Without the permission we cannot take the photographs of the patient. Okay? So like this we have applied to the patient in menorrhagia. The patient responded. And one more observation what I have seen in cases of menorrhagia is the patient is having abnormal uterine bleeding like amenorrhea followed by menorrhagia. They will not respond to cupping. Rarely they will respond. Usually you are having primary menorrhagia, that means they are having regular cycles without any cause. In those cases, usually the patient will respond very well to dry cupping below the breast. Why the patient is not responding in cases of patient who are having amenorrhea followed by menorrhagia? That is because what we say, DUB also we say, these terms are now abundant. We are not using menorrhagia, we are not using dysfunctional uterine bleeding nowadays. Now the classification has been changed to palm coin according to 2011. The classification has changed. Now we are calling palm coin classification. But to better understanding, I have used the old terms only. Okay? Then inflammation of the uterus. Here again they said wet cupping. So wet cupping was said first time, second time they are getting wet cupping. First time, if the patient is not responding to any treatment, they have to go for wet sacrococcygeal in menorrhagia. Second wet cupping, they have said it inflammation of the uterus, that is endometritis. Now, when we say inflammation of the uterus, you can include adenomyosis as well as endometriosis in this. Okay? Not only endometritis, but we can include endometritis and adenomyosis. Okay? So we can apply the cups on the inner side of the thigh. Then in amenorrhea, we can go for wet cupping. Okay? Amenorrhea, menorrhagia and inflammation of the uterus, you can go for wet cupping. Okay? For dysmenorrhea, we are usually using cupping in our institute. Patients are getting response. They usually come to us. Madam, please do me dry cupping. I got very good relief because of cups. Okay? They will come and advise us, Madam, I want to go for this treatment too. But one drawback is that young children, young girls cannot come because they will have usually colleges or that. Sometimes the compliance will be less because to come at the time of duty hours, it is difficult for the students, especially. Okay, next is wet cupping in amenorrhea. When we should apply wet cupping? If the patient is obese. Wet cupping in cases of amenorrhea in all cases should not be applied. It should be applied if the patient is obese. Second, if you are thinking the patient is having Ifrat wa Gilzat-e-Khoon or Mizaj-e-Barid. So you have to calculate the temperament or Mizaj of the patient. If the Mizaj is Barid, then you can go for wet cupping in cases of amenorrhea. Okay. Now how to apply the cups in the cases of amenorrhea. So if you see, the best description is given in Zakira Kazim Shah. They have given the total procedure how to do wet cupping in cases of amenorrhea. So wet cupping should be applied with vivisection. Okay. So in cases of amenorrhea, they said that Hussain and cupping both should be done together because what is wet cupping doing? Tanitya Barat. Whereas dry cupping is only doing Himalayan cupping. There is a difference between both. व्हेन हमको बदन का जब तनख्या करना होता है, जब हमको वी हैव टू यूज वेट कपल. सो यहाँ पर क्या हो रहा है एतबाज़ हेल्थ में? व्हाट्स हैपनिंग इन एतबाज़ हेल्थ? देयर इज इफरात व गिल्ज़त खून, देयर इज मिजाज बारिद, and patient is obese. So here